Hi, my name is Dr. Steve Byer. I'm a chiropractic doctor in Frankfort, Illinois, is where my office is at, and I have a practice that specializes in functional medicine. And so as a result, I treat a lot of people with thyroid conditions, and what I'm doing today with this videotape is just giving a brief case study of one of the many patients I've had over the years who's responded very well to a natural functional medicine approach. This particular patient came in with the following symptoms. She was experiencing fatigue, had experienced weight gain, some GI issues including gas and bloating, constipation, diarrhea that kind of alternated. She had a kind of an unusual symptom of she would have food kind of get stuck in her throat, or the sensation of it getting stuck in her throat. A lot of body swelling, headaches 1 to 2 times per week, and a lot of nervousness. Those symptoms had gradually increased over the course of 10 years. She had been suffering with this, in spite of the fact that over that period of time she had been on thyroid medication, and she hadn't noticed any improvement right from the get-go with the fatigue levels as well as the weight gain, and had, in addition, had the onset of a lot of these other, or all the other symptoms that I mentioned that she had. And she also had been placed on antidepressant medication for the nervousness and brain fog and things like that she had experienced, but didn't notice any improvement with that also. So just to give you a quick rundown, and we're going to take like just 3 or 4 minutes in going through this, but this is by no means, unfortunately, an unusual type of case presentation, and fortunately is not an unusual response that someone gets with the type of care that I give in doing a functional medicine approach. First off, we did the right blood work. That's one of the main reasons why people don't get better, is they don't have the right blood work done. Her blood work showed that her thyroid was dysfunctioning, but not because of a result of her thyroid not producing enough hormone, which is really the only reason why someone should go on thyroid hormone medication. Her blood test showed that her thyroid was underactive for 2 reasons. One, secondarily due to some other hormonal imbalances, which were related to blood sugar issues that she had, but also she was starting to develop some autoimmune attacks against her thyroid, meaning her immune system was mistakenly recognizing her thyroid as being foreign. Her blood test also showed a lot of inflammation. One of the inflammatory markers that we measured should be no higher than 1. Hers was at 7, so it was 7 times higher than what it should be. She also showed some various vitamin deficiencies and again, a blood sugar abnormality. So what we did was we started to address through real specific dietary protocols and nutritional supplementation some of these issues, but then right away, to begin with early on in the care, we did some other specialized lab testing which was necessary with her. We knew that she had a blood sugar issue, but we didn't know exactly how or why that was, so we did some salivary hormone testing and found out that she had significantly low cortisol levels early on in the morning and some low levels of another hormone called DHEA. We corrected that issue. We also identified through the blood test and through her symptomatology that there was a high likelihood of there being an infection, some sort of microbial infection within the GI tract. So we did a stool microbial test, and lo and behold, we did find what's called a Helicobacter pylori infection. It's a specific type of bacteria, as well as a Campylobacter infection. Helicobacter pylori can cause ulcers, among other things, but it was definitely contributing to the symptomatology of gas and bloating that she was experiencing. And she also had a parasitic infection and an imbalance of the normal flora. So we corrected those issues. Those infections, in fact, most of the time don't need prescription medications to kill if you know exactly what microbe is there that can be corrected and eradicated through natural supplementation. And we were able to achieve that. A subsequent stool analysis showed that those infections were gone. We didn't just guess, we actually did a repeat stool test and found out that the infections were gone. And the initial blood test, because of the inflammation as well as some other things, showed a high likelihood of there being food sensitivities. We were able to pinpoint that with specific laboratory testing, very accurate blood draw testing, not skin scratch testing, which is really inaccurate. So we pinpointed exactly which one of the potential problem maker foods were causing her problems, fine-tuned her diet, and in 4 months' time, if I could just relate what she in her own reporting showed an improvement in, In 4 months' time, her fatigue levels had improved 75%, meaning 0 would be no change at all, 100 would be no fatigue at all, 100% recovery, 75% within 4 months. That's really, really good. The gas and bloating had improved 90%. The diarrhea and constipation was totally gone, 100% elimination. Her sensation of food being stuck in the throat had diminished 75%. The swelling of the body had reduced 90%, and her headaches were diminished both in intensity and frequency, 90%. She hardly had any anymore. And the nervousness, which she also was on medication for, depression and nervousness and anxiety, that with this natural approach, which identified key underlying issues, that symptom improved 75% also. So this is not unusual, folks. This is not an unusual type of response at all. This is very, very typical within a 4 to 5 or 6 month treatment plan for people who are experiencing symptoms of 10 or more years, 10, 15, 20 years. They can experience that type of improvement with this natural functional medicine approach. I highly encourage you, if you're doing the same thing over and over again and expecting different results, like taking the medication and maybe even having doctors tell you everything's normal, which I get a lot of times. Patients coming in telling me they've had tests and everything's normal, when in fact we actually identify the problems. If you're in either one of those groups, give the office a call. Take advantage of the offer that we're given. Within 1 week of posting this video, we're offering that folks can come in and get an evaluation done with us, which is normally $125 for just $50. Meet me, talk with me, see if it seems like a good fit. Have me do an evaluation, see if it looks like you're a good fit for me in terms of being a good candidate. You can get these kind of results, more than likely. I see it again and again and again with folks with conditions and chronic symptoms lasting 10, 15, 20 years. So give the office a call, 815-469-8500, and set up an appointment with one of the ladies at the front desk and see if we can get you back on track.